Hey, welcome back to Not So Complicated, and today we'll be talking about acute intermittent porphyria, its pathophysiology, presentation, and diagnosis, right? So, we all know that porphyria is a collection of symptoms or diseases or manifestations, or it is a syndrome caused due to the defective enzyme in heme synthesis pathway, right? So, we all know that heme synthesis is a multi step pathway, and there are a lot of immediate or intermediate enzymes acting upon that, and these different enzymes, if they are defective, will cause different manifestations. And in this case, that is acute intermittent porphyria, let's talk about the pathway first. So what happens is glycine gets combined with succinyl coenzyme A to form ALA, that is aminolevulinic acid at first, right? And this ALA will get converted into the porphobilinogen, which is here. So that PBG or porphobilinogen will get converted into HMB, that is hydroxymethylbilin, via an enzyme called PBG deaminase. And this is the defective enzyme in acute intermittent porphyria. So this enzyme is deficient actually, right? So what actually happens if this enzyme is deficient? So porphobilinogen cannot get converted into HMB, right? So that is how the pathway to become will be obliterated in this step. So HMB is decreased, and also porphobilinogen will get accumulated, that is porphyrin buildup will happen. And porphobilinogen, not only that, but the products prior to that, which is ALA, that is aminolevulinic acid, these also accumulate in different regions, right? And that accumulation will lead to different manifestations, that is neurovisceral manifestations. And out of that, let's begin from central, that is anxiety, depression, seizures, insomnia can happen. And in peripheral, that is myopathy, paralysis, respiratory paralysis can also happen, sensory loss or fatigue can happen. And in autonomic manifestations, there is abdominal pain. Abdominal pain is colicky. This is a typical feature of an acute intermittent porphyria. You had to remember this. Nausea, vomiting, then hypertension, constipation, and tachycardia. These all are manifestations of acute or intermittent porphyria, right? And also cutaneous, there will be pruritus, and these all symptoms are, this pathway is aggravated by drugs, right? So that is how the pathophysiology or manifestations of acute intermittent porphyria are. So let's talk about the diagnosis of the disease. What actually happens in this is that we have to look for PBG, ALA, total porphyrins from the same urine sample, right? So all these PBG, ALA, and total porphyrins will be increased in serum sample, and also in same urine sample, right? So that is a diagnosis. And also, if you see the urine color, it is port wine on exposure to light due to rearrangement of molecules. So port wine color urine is typical for acute intermittent porphyria. You may have to remember that, you have to remember that. And the non-specific findings in acute intermittent porphyria is hyponatremia, which is most common, and hypomagnesemia is also common. Mild aminotransferase elevations can happen, and also mild leukocytosis can occur. So this is the non-specific findings in the diagnosis. So that is all about today. Subscribe for more clinical polls like this. Thank you for staying with me. Please subscribe.